Hi, welcome to Success Factors. I'm your host, Brenda Siri, and today I am joined by David Huerta, CEO, and Sara Greenberg, COO, who are both co founders of Whole Person Virtual Care. Thank you both so much for being on the show today.
Well, thank you for
Okay.
asking us, Brenda.
Yeah,
It's an honor to be
absolutely.
here.
Absolutely. David, I know you've had over 30 years in the insurance industry. That was your career, right? And I'm sure you've seen a lot of changes over the years. In the past, you created a delivery model to compete against the insurance carriers
Mhm.
that was based on transparency.
Yeah.
It was clear to you where the conflicts of interest were within the system. Can you tell me a little bit more about that?
Well, that's deep, Brenda. I mean, that's very deep. And yes, I was a benefits consultant for many years and recognized that what was going on within the status quo was not good. And we created a delivery model to compete against the carriers. So you had the carriers on a spreadsheet, and then you had our model. And we we did seminars across the country to CEOs and CFOs, exposing where the conflicts of interest were, but more importantly is we gave solutions to it. And what the status quo consists of, it's a web of industries that's weaved together that doesn't protect the best interest of employers or those that employers are covering, especially if they're self-insured. And then on the fully insured side, that status quo, especially with the influence of state and federal rules such as healthcare reform with the medical loss ratio or state mandates, all of this compounds to increase rates to employers.
Hmm. So, what's been considered the status quo for businesses who are purchasing benefits for their employees?
What's considered the status quo? The status quo is keep doing business the way you're doing it. And you can't get coverage elsewhere. And, if you wanna be creative, that your head's top down. There's a lot of industry professionals that are recognizing the fact that you have to be bold enough as a leader, especially if you're running a company and buying benefits for your employees. You have to be bold enough to say enough is enough. When you look at what's going on with insurance premiums, if you're fully insured, if you looked at what's going on, if you're self-insured, these things that are being told out there simply aren't true. The model we created, and I don't want this to put me in a box, but we were mentored by two revolutionary gentlemen who created reference-based pricing back in 2011, 2012. And the administrator for the program was out here in Dallas. So, but what Bob and I, my former business partner, who I'm still very good friends with, um, what we did was revolutionary. And now there's many visionary brokers and consultants that are taking that model to a different level. There's all different ways that employers can control their spend, but you gotta get out of the broken system. You have to create a better way. And if you're stuck in it, if you're a smaller employer, well, guess what? There's solutions out there like whole person virtual care that can supplement your benefits. We're not insurance. I'm at my company was built, it was acquired, and Sarah and I recognized the need that people needed to get access to care, to doctor, physician, nurse practitioners when they needed it. So we created whole person virtual care with an established platform behind us. So while we may be new as a company, the platform that's behind us has been well established, and now the company behind us is a significant company. So it's very exciting to bring a new solution that employers should hear about, should use to supplement their benefit. In fact, if I could speak to the audience, so folks, if you manage a benefit program, we're not here to replace your agent or your broker. We're not here to replace your carrier, not at all. We're here to share with you that for 180 bucks a year per employee, your employees can have access to healthcare on demand within 30 minutes, within 8 minutes if you choose a certain methodology. All care is provided by a licensed provider in that state. It's it's really special, Brenda, because It's not talked about in the industry, and I'll tell you where actually, I take that back. It is talked about in the industry because telemedicine or teleprograms are becoming a buzzword, sort of like direct primary care and other terms in the industry. But where this is different, okay, this is an independent medical practice that keeps records, that diagnoses and provides a treatment plan 96% of the time on the first encounter. So it's successful, over 6 million encounters, 96% resolution on the first basis. So it's a proven solution, ladies and gentlemen, and for benefit consultants, please learn about us, okay? Because I know what was broken in the system. I was there 30 years, and this is a solution, and it's a long term. It's a fix. It's a fix to what's broken.
Sarah, I know years ago when I started working, my employer paid for my medical insurance. It was a nice perk. I went to work, I worked, and part of what I got besides my salary was benefits, healthcare benefits. And things have really evolved over the years, and employers started kind of scaling back and making employees absorb some of that cost. So with your product, I mean, $180 doesn't sound so horrible at all, but what is the benefit to an employer in adding on your services on top of what they're offering their employees today?
So with our platform, what we're seeing is um, healthier employees because it helps reduce absenteeism. Because when they have an issue, they have access to this virtual medical practice with providers that will return a call if you choose to do video or phone in less than 15 minutes. And their goal is to give you a diagnosis, to get you the help you need as soon as possible. They want you back on your feet and healthy. And so this is what people are seeing, and this is a $0 visit. So because it's not gonna there's not these co-payments and these additional costs, they will seek the help as opposed to withholding their health because, "Oh, I don't wanna really pay this. I don't really trust this." This is a trusted platform of, um, providers that they can access to give them their help. And the other thing that's really nice is that it also includes their family, their spouse, and their dependents to the age of 26. And it doesn't matter if um, the spouse and the dependents aren't on their regular benefit plan. This sits above that, so they can add them onto this, which is a really nice feature, all in that same cost. There's not additional cost to add the family. And again, it's a $0 visit, and there aren't limits.
Right.
So it makes it when someone in your family's sick, it affects everybody.
Yes.
Sure.
So now everyone has access to this, service.
Right. So, for the broker consultants, agents out there, and for employers, we created the plan design the way we did because I understood that it should be simple, right? So what's simpler than a single rate or composite rate in the industry that covers, as Sarah said, your spouse and children, not to age 18 when they're an adult, but to age 26 to align with medical programs. Okay, again, we're not insurance. We're a supplement to a medical plan to give people access. And the other thing that we did, Brenda, because we're not insurance and we're not governed by state rules and federal regulations and all that, we were like, you know what? This is a supplemental benefit. Provide it for your full-time employees, whether they're on your medical plan or not. Provide it to your part-time employees who need coverage. Provide it to your seasonal employees that are working the chairlifts in the wintertime. Oh, provide it to your 1099s. Sarah and I and our team are passionate about giving
Mm.
people access to care.
Mhm. You know, it's interesting because I years ago worked for a company that had a call center, and a lot of those people made a very, very low wage.
Right.
And so, even though they were full-time employees, when they came on and saw the cost of insurance, they didn't sign up for it. And even with the employer covering part of those insurance costs. So, I can really see this being a benefit to, people who are making a lower wage because it's really amazing that they could get this kind of coverage for their whole family.
Right. It's all
Yeah.
on back end financing, for those of you that are in the industry, there's no claim charges brought back to the plan. So our per employee per month fee, that's all. It's a simple expense to the employer with no back end claim charges coming back to them. We don't want to be in that bloodbath war with the telemedicine world, right? Oh, I can give you a cheap rate of $3, but that's an admin fee. With that, oh, there's gonna be a claim cost, there's gonna be a copayment by the employee, and there's all of this record keeping that has to be done. Mm-mm-mm. When we created our model, we were like, "Let's keep it simple. Let's keep it easy. Let's give employers an opportunity to enhance their benefit program," because we all know where benefits are going. When you have the guardrails of healthcare reform telling insurance carriers, if you're fully insured, that you could only make 15, the medical loss ratio is what I'm talking about, folks. When you have a maximum area of margin, 15% over 100 employees, 20% under 100, what's gonna happen to satisfy shareholders in Wall Street, right? So so this is a way, and while that's going on, as others know, your quality of the plan, whoops, goes down. So you're having higher deductibles. You mentioned in a earlier conversation how, a company you were recruiting for had an $8,000 deductible.
Mhm.
That's not affordable to most people, especially those are working, for 15, 18, $22 an hour, or building a family. It doesn't allow for savings. And people are making decisions. Should I get insurance, or can I go get some food? Or
Mhm.
can I pay this electric bill? That shouldn't happen in America. We have the best healthcare system, one of the best healthcare systems in the world. It shouldn't be reserved for those that have wealth. It should be open and accessible for everybody that's in our country, that's an American paying taxes, or
Well, and I
citizen.
would I would think for an employer who does cover a portion of benefits, who has a workforce who is more at the minimum wage level, if they're skipping benefits because they can't afford it, I bet the portion that the employer would be paying for insurance for them is far more than $180 a year for an entire family.
Well, you could look at sorry, go ahead.
Well, and the other thing I was gonna say is the breadth of the service too. So, I mean, we offer the acute urgent care, family care, talk therapy, and we also now the big thing is weight management.
Right,
So you're getting all these wonderful options of areas that people who have issues fall in
right.
this area. And so now they can have all of this and have access to it, and their entire family does.
Yeah,
That's exactly right.
that's
I mean,
great.
we're compassionate about helping people, okay? And, it's weird to say we're compassionate being in this industry, but our model is, we have to get healthcare out there to people. And there's a lot of different types of ways to get healthcare, to get reduced costs, whether it's reference-based pricing, patient assistance programs, whatever's available. You know, a lot of great brokers out there are compassionate about their clients, and they're going away from the broken system, the status quo. And I'll encourage everybody, learn about us, because we are a solution that works. It's not a wannabe. The model started back in 2013, and as Sarah said, has progressed to give people better access to care.
I know you have such a long career in the insurance industry. What's the benefit to a company in becoming self-insured, and how would they go about doing that?
Oh my gosh, you have an hour and a half?
No. No, I don't.
Well, for those of you that are new to this question, for those of you that are experienced in the question, I have to be brief in this, so I apologize. But to be self-insured means that you get out of the state oversight. You now become regulated by the Department of Labor, ERISA, okay? And so when you're self-insured, you're basically saying, "Okay, I'm gonna pay the cost of claims to a certain level." That certain level is a bigger number. It could be $50,000, it could be $500,000, depending on your size. When I was in the industry, we had those deductibles were higher than that because they were large companies, nationally. And so when you're self-insured, you're in control. Okay, this is for people that want, good risk managers. In fact, our model, we created a captive for it's a way for financing insurance to and that's a whole other story. But we were underwritten by Berkeley Accident and Health. And in 2020, we earned their highest award for risk management inside of their captive. And for those of you that are in the industry, we return surpluses every year while I was involved with the business. I retired in 22. But we had fun and we made this model, okay, this self-insured model within the captive. We made it employee friendly with this virtual program, with this virtual platform. Why? Because we wanted to give employees access to care when they need it. We didn't want them to withhold care. And in fact, a recent statistic came out about 2 weeks ago. 40% of people with coverage withhold care, and over half of them, because they withheld care, the conditions worsened, which means what? Increased costs in the future, more downtime, not as productive at work. And so this is a fun way to fix it. So self-insured, Brenda, it gives you the opportunity to create a plan that's more the culture of your company. When Bob and I created plans, we had a lot of different types of clients, but there was a commonality, musculoskeletal issues, right? MCLs, ACLs, shoulder issues, carpal tunnel, things like that. And so we befriended the CEO of a company called Regenex. Regenex is great. It's revolutionary. But what it does is it takes your own biologics, centrifuges it to get the high density platelets out, right? And then it inserts it specifically where your muscles are degenerating, right? So instead of going for orthoscopic surgery and getting all of that expensive stuff done, you're inserting your own biologics into where the affected area is, and people were getting I don't want to say cured, but they were regenerating those issues. And so I had my procedure done in 2015 or 16 for knees, and it was unbelievable. And we can go into a story on that, but Regenex is a benefit to employees that we were able to put into the plan design because we were self-insured. And so it's just self-insurance is great. And for those employers that are smaller, under 50 employees, or in some states you can go down lower, there's ways to take control. It may not be self-insured as we just described, but there's ways to share the risk with carriers or with an administrator. Talk to your broker or agent. There's ways to protect yourself.
Is there a financial benefit that comes to a company by being self-insured?
Oh, absolutely, and again, if you have an hour and a half, but yeah. Yes, talk to your broker about it, but there's significant benefits if you have the right risk management tools in place. When you're self-insured, you peel apart what a carrier's given you, right? So you have physician claims, you have hospital claims, you have pharmacy claims, you have specialty pharmacy claims, and you have other things that add to claim costs. Then you have an administrator, who's like a carrier when you call customer service. So there's things that self-insured will require. It's not a passive management thing. You got to be involved, and with great risk management, you could do it. And Brenda, having now being an advocate for employers, an advocate for brokers, agents, consultants with solutions, there are things that you reach out to me. There's things you know, Patient Pal is another incredible solution for people to get access to registered nurses to escort them through a plan, whether it's with carrier A or carrier B or carrier C. people need hand-holding, they need that advocacy, and so, that's what we're here for. We wanna bring positive experiences into a world that's not good right now.
Mm. Sarah, I know that you're both firm believers that companies should take back control of their healthcare on their terms.
Right.
What does that mean to you?
Basically, as you know, every individual employee, you want to be able to take care of yourself and not have to always rely on your insurance plans or what's out there. And so having access to a virtual medical practice that doesn't cost you anything additional to do, to use, and be able to get the support and put in, you don't you cut your finger and instead of like, "Oh, do I need to get stitches or not? I don't wanna go see a doctor," and you can put a call in and be able to say, "Oh, yeah, you have this flap on there. That's okay. We can put a Band-Aid on it, tighten it, and do something, and it's good." Um, or you have to go get help. But you're able to get and seek the help that you want immediately
Right.
and have that type of control to be able to do that.
Our mantra is, Brenda, take back healthcare on your terms, right? That means get the care you want simply, timely, and affordably. You don't need this web of rules by a carrier. You don't need these huge deductibles that you have to worry about. You don't have to worry about, can I afford the care I know I need something? Just get the care you need when you need it, whether it's your child waking up at 2 in the morning or whether it's you saying over the weekend, wow, I think I have strep throat. It's okay. You have a doc in your back pocket. You have a person to take care of you on demand.
It's nice.
It
Yeah.
gives you that comfort. It
Yes.
Yeah.
gives you that doesn't matter if you're on vacation, on a business trip,
Yep.
at a conference, you have access to care
Yeah,
that you need.
exactly.
What trends in employee benefits are more employers asking about today?
Well, there's a few good trends out there right now, Brenda, and there's a lot of exposure or chatter on LinkedIn. There's some great leaders out there, recognizing the fact that the status quo system is broken. And so you have a different type of alternative financing. You have different type of accessing care, direct primary care, virtual primary care. All of these things are out there. But the real problem, folks, is the status quo. You have to break away from what you think you need when you really don't. There are solutions out there that are magnificent for your employees. They build your culture better because it shows you care. Don't just sit back. And Mark Cuban talked about this about 2 weeks ago. Don't sit back and just take a renewal on, okay, I started at 29%, I got down to 25%. No, don't make renewal decisions a financial decision anymore. Make it about what's right, getting access to care, providing better type of benefits for it, and it's great. In a recent interview, I was asked, is virtual care good? Because there's this perception that every carrier offers telemedicine and they're all equal and the same, but they're not. All right, this is an actual practice that Mayo Clinic evaluated and said, care delivered here is just as good as if you went to see a doc in an office. And I would claim it's better. I mean, it's better. Why? It's better because you don't have to make an appointment. No appointment necessary. You don't have to hop in a car, drive to a waiting room, wait, and sit in a waiting room, get other sicknesses. You don't have confusion of what to do. Let this become the new front door to care because it follows you. Whether you have carrier A or carrier B or carrier C, and every time you make a change, your employees have to go through the changes with you. Well, this sits above it all.
Mhm.
Let your employees have this, and when you make that change to carrier B, this is still here. All records are kept. Move to carrier C, guess what? Your employees know how to work this, right? So it's fun. I love what we're doing. We're having a lot of fun bringing a proven solution to people.
So when an employer is looking for, virtual healthcare coverage, maybe they're working with their broker to find that, what should they be looking out for and what kind of makes whole person virtual care the choice that they might want to consider?
Well, one of the things that is really important is the independence.
Mhm.
Um, this virtual medical practice does not have to follow rules of a hospital or, insurance plans
They're
that
not
have,
beholden to
y-
anybody else. They're
yeah,
independent.
yeah, they are not purchased by them. So it allows them to be the doctors and nurses that they want to be
Exactly.
and provide the service and get people healthy. Um, Fun statistic, 96% of first call encounters have resolution,
Right.
and there's a 95% satisfaction rate. So to have that independence really helps a lot with that. Um, the other thing is the breadth of the
Services.
services that you get. Sometimes, it's limited just to, acute urgent or to add on other features like mental health care, like having prescriptions, all of that tends to cost more money. And so you don't have that with this. It's a $0 visit
Right.
and there's no limits.
Hmm.
So that's really nice too. It's not like, okay, you only can go to twice and that's
Right.
it.
So for those of you in the industry, it's fully integrated. We have a fully integrated platform that's easy to access for your members, for your employees. It doesn't cost them anything to access care. There's no limits, right? And so it's a one-stop solution.
How can virtual healthcare help reduce healthcare costs without sacrificing
May I?
quality? I mean, I guess what I'm wondering is, could this actually help a corporation have lower insurance costs because they've got this amazing opportunity to provide to their employees?
That is an incredible question, okay? And I'd like to answer that with a couple bullets, okay? Because there's a lot of depth to that question. So uh, it doesn't lower insurance costs
Okay.
because we're not insurance.
Right.
But for those of you that are self-insured, okay, what it will do is it'll reduce the number of claims that you have by your employees or their dependents going to a doctor. It's a fee for service claim is a term in the industry. It'll reduce the high frequency fee for service claims significantly, whether it's a doctor's visit, whether it's an urgent care visit. They don't have to go to urgent care anymore. Whether it's an emergency room, well, they'll go to an emergency room for a non-emergency situation because it's the only thing open in the middle of the night and I need help now. So when Bob and I had our block of business, our claim costs went down for those high frequency claims. And guess what? Our model's not going to charge you back every time that a member calls or your employee calls or the dependent calls. No, this is a PEPM that's fixed. We're not going to get into that, low admin price with all of the upcharges and stuff like that. And we're not going to put a limit on it. Why would you want your employee saying, "Oh my god, I need to get help now, but I've used it 3 times already. I'm out of visits. How much is this gonna cost me?" With whole person virtual care, it's 0 cost per visit, and you don't have to worry about limits.
That's great.
And the other thing that's just the company and helping the company
Oh, good
save
point.
money
Yep.
is that it reduces absenteeism.
Mhm.
Look at a trucking company. If your trucker is sick and he can't do his job for that day, how many other people are going to be in that chain of events
Yep.
now are going to be stuck and not be able to work or finish their job because the chain has been broken because that trucker is not available,
That's right.
or you're going to have upset clients because things were not delivered when they needed to be delivered. So it's not just the insurance and reducing that claims, it's also helping the company to be more productive, their
Right.
employees to be more productive, their families to be healthier. So everybody is thriving.
That's
Yeah.
right. When we were speaking in Chicago 2 weeks ago, and Sarah mentioned the fact that you have improved, healthier employees. who are producing more and the reduced absenteeism. We had the CEO of a national firm almost jump out of his chair and said, "This reduces
Wait,
absenteeism."
wait, wait. What does it do? It reduces absenteeism. Wait,
Right.
we need to talk.
That's right.
Yeah.
Yeah, because, if working mom or working dad, you wake up in the middle of the night to take care of your child, you rush into the emergency room, you get back at 6 in the morning, you go to work tired,
Mhm.
or you're calling in sick. This stops that, Brenda, and it's not under it's just it's the care you need when you need it on your terms.
I mean, I've worked in HR for many years, and I know that this is huge. This is really beneficial because you're right. I mean, improving, wellness with your employees,
Yeah.
their productivity, it's just sounds like a phenomenal product for companies for sure. I know United Healthcare recently, sorry, I'm going to do that over again, Brenna. No, you go up, go up, go up, go up. Thank you.
Wanna take
Um,
this one?
Okay. I know that United Healthcare recently reported that ER visits are increasing while virtual care is decreasing, and that makes no sense to me. Why is that?
It was a sad statistic from United Healthcare, and we can say it because they produced a report. In my opinion, and some of you may agree with me, some of you may not, but in my opinion, why would you have a reduction in virtual care? You have a reduction of virtual care because the experience is not good. The intake questions are not they're too big. The intake should be about your issue. I went to San Juan, speaking of San Juan, came back with a rash on my hand, and it drilled right down to what my rash was about. In my opinion, Brenda, it's about the experience that a person has, why if you had a positive experience with something, if you got into the system and you answered questions specific to what your issue was, that makes it easy, right? So our triage is simple. It's specific to what's wrong with you. If you're going to charge a copayment, people don't want to pay copayments. They're going to not go there. I remember seeing plans where a virtual office visit is the same charge as a specialist office visit or a primary care. Well, those are averaging $40 to $50 now. So it's the experience. And then remember this, this is not to be negative, okay? I'm not being negative, just being real. When you think about the provider on the other end of the phone, what's their motive? You know, are they motivated to get you back into the broken system? I mean, Sarah's first experience with the carrier was she ended up taking almost an hour to go through the intake, waited 2 hours to get a call back, and then that provider sent her to the urgent care center. That's not going to happen with us. We have an independent provider and independent providers, and they're there to take care of your health. So why is the increase in emergency room visits simultaneous with the decrease in virtual care? Because those people are going to the emergency room to get the care that they should be able to get at home. And that's just my opinion, and I'm sticking to it.
Stick to it, David. So whole person virtual care is an independent platform, and you're not owned by an insurance company, and you're not owned by a hospital system. What is the benefit to employers, medical providers, and patients?
So, as an independent, as we were saying a little bit
Okay.
earlier, that as since they are independent, they are not required to,
Oh,
um, you know, send somebody back in the system to make money.
right,
Okay, what they want to do is they just want to get you help.
right.
And it's not transactional. They want to find out what your issue is and they want to get it resolved. They want you to be healthy and happy and thriving. So
Exactly.
I think that's the biggest difference is they're not owned by anybody
Right. And
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 beholden to anybody.
Right.
at Freedom Fest last week, there was a whole panel on healthcare in America, and so I spoke to a couple of panelists afterwards, and it was about how the independence of providers is going away because they're being acquired by systems, hospital systems across the country, whether it's rural, metropolitan, doesn't matter. So I used a term I thought Twyla was going to come unglued. I said, "Yeah, you have to wonder what the what the intent is when a provider orders a test, even though they know it's strep throat or they know you have a UTI. Why do they order and test?" I said, because when you work for a hospital system, now you have to generate revenue. They're revenue generators, not able to be free to be a doctor. She turns to her assistant and says, "Write down revenue generator."
Once a company decides to sign up for whole person virtual care for their employees, what happens if an employee leaves the company? Do they get to take this with them or does the employer own it? How does that work?
Well, that's a great question. We're not insurance, right?
Right.
So we developed, and this is a lot thanks to Sarah's thinking, is we wanted to make it available to individuals, independent of an employer. And so, for those of you that are listening that are interested in getting access to this concierge medical practice, if you leave employment, then you can simply buy access to care. It's online. The annual charge for access to care is $275 as an individual, or if you're covering spouse and dependent children to age 26, it's $395. We wanted to keep it right affordable
Mhm.
for people to access care.
That's great. That's great. So, with the many benefits that come to an employer who enrolls their employees in the program, what's the monthly cost per employee again?
Okay. So remember, those of you in the industry, this may seem high to what admin only rates are out there, right? So our per employee per month fee, where claims are never charged back, will vary between $15 and $18 per employee per month to cover the employee, their spouse, and dependent children. And that's it. No claim charges come back. Now, if you're 10,000 life group, we'll work with you on pricing. We'll do multi-year contracts if that's what we need to do. And for those of you that are really large, there's alternate ways to get a price model based on your utilization if you have over 20,000 employees.
Okay, that's great. Um, I mean, 15 to $18 a month, that's such a small cost to keep your employees healthier, more productive. I mean, it's phenomenal.
It's 8 cents an hour.
Yeah. And
And it's something that they appreciate.
yes.
Good
And
point,
that's been a
Sarah.
big thing
Yep.
is that employers, they want to take care of their employees, but they're just out of funds to
Right.
Right.
to to, give the
Exactly.
benefits. And so this is something that they can give that employees love. And we just recently had someone who signed up and they are fully funded. And they decided to use this and they said that this has been the biggest retention of employees and when they're out there looking, getting the highest quality people, they said, "We have this, but hey,
We have
we
this.
have
Yes.
whole person virtual care,
Right.
Right.
and this is what it offers. You have access to like a doctor in your back pocket
Yep.
24/7, and it doesn't cost you anything additional,
Right.
and they are loving it."
Yeah.
This is something that is going to help the culture of a
Yes.
company, right?
Exactly.
Yes.
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 It's a culture benefit. That's great. So, for anyone who is watching the show today who's interested in learning more about adding this to the perks that they are offering their employees, that I'm going to call it culture generator instead of a
There you
revenue generator. How do you like
Well,
that?
I like that, right?
There
We
you
are the
go.
culture generator.
Yes, exactly. We're going to show a slide that's going to have your QR code and a way that those employers can connect with you to learn more about your services and what they can do to help their employees have better productivity and wellness in their lives.
That's right. That's
Yeah.
right. And if for those of you that are self-insured, um, if you send us your claims data, just a few data fields, no PHI, you know, s- uh, let's talk because we can do an actual savings analysis for you because as finance people and many others know, numbers don't lie.
Mhm.
So let us show you what could be saved.
I love that. And I'm dumb. What's PHI?
Private health information.
There you go. Okay. Somebody else might not know either who's watching. So, well, thank you both so much for being on the show today. I think any employer, should be really thinking about this
Mhm.
culture generator and what it could do for their employees to give them better health, productivity. And I love the fact that your product isn't just about, making that call to a teledoc.
Right.
Um, to find out if they need to take aspirin or penicillin. I mean, I love the fact that there's talking to what am I trying to say? You talked about almost like having a psychology
Right,
person that you can talk to, a therapist, that kind
right.
of thing, right? You can tell I don't spend time talking to therapists. Maybe I should, but
Yeah.
but I love that that's a benefit, that it's that one cost for the whole family. I really like what you guys have developed. So
Yeah,
Thank you.
the breadth of the platform
yes,
is really wonderful. I
yeah,
mean,
Yeah.
it kind of hits all those areas that people need help with.
right. I love it. Well, you've done a great job creating this product. Thank you both for being here, and wish you continued success with
Mm,
with whole person virtual
yeah.
care.
Thank you.
Thank you very
Thank
much.
you, Brenda.
We appreciate your support.
Yes, absolutely. Well, that's it for the show today, but employers, check into this. I think it's a really good culture generator for your people, and I hope you'll consider doing something like this for those who do so much for you. So that's it for today's show. We'll see you next time. Bye.